Hello, my name is Bulusu, and in this video I'm going to be demonstrating muscle percussion technique on the calf, so the gastrocnemius and the soleus in the posterior leg. We're going to start with some light pressure on the area, and we're going to work across the entire tissue for about 60 seconds. Mom, how's it feel?
Good.
Is that enough, or do you want more?
It's good.
Feels pretty good?
Yeah.
So if there were any areas that felt more tight or tender, I would spend some extra time, maybe 20 to 30 seconds, focusing in on that area. But because I don't notice any of that, we'll go ahead and wrap up at around 60 seconds, and then we can repeat that to the opposite leg. And in this video, I'm going to be demonstrating muscle percussion technique on the hamstrings, so the semitendinosus, semimembranosus, and the biceps femoris laterally. Because this is a larger muscle group, I'm going to start with a little bit higher intensity on my massage gun to work into those tissues. Start laterally and work medially. Mom, how's it feel?
It's good.
It's good? So just being careful to stay more on the muscle belly, not working into where these muscles become tendinous, as this will start running over some bony landmarks in the end of the femur and the beginning of the tibia, or the knee joint. So staying off of that, staying in more of the muscle tissue. And overall, it feels pretty good. That is muscle percussion technique. We're going to be working on the piriformis in the posterior part of the glute, deep to the glutes, running from the sacrum across to the greater trochanter. So we're going to work in this diagonal right into here. Now this could be a little bit more of a sensitive or tender area. So Mom, how are you doing?
I'm okay.
Alright, and I'm going to keep the pressure low until she feels like she can handle more. And because this is a pretty small muscle, we're in this area, I probably keep the time lower, closer to 20 to 30 seconds if I'm specifically trying to work to that piriformis muscle. That is muscle percussion for the piriformis. Thanks, Mom. Hi, my name is Bulusu, and in this video we're going to be doing neuromuscular stretching for the calf, so the gastroc and the soleus. So what I'm going to do is I'm going to get my patient's foot into a neutral subtalar position, and then what I want to do is stabilize the knee and then press some forward pressure to get that stretch. I'm going to work until I feel some resistance, so right about there. Now Mom, what I want you to do is gently push on the gas pedal against my hand. Good. And you're going to hold it for about 7 seconds. So let's go another 4, 3, 2, 1. Relax. And after a brief pause, I'm going to try to stretch a little more. And what I can feel is that I can get a little bit of a deeper stretch on the calves, and I'm going to hold that. Ooh, slipped. But I'm going to hold that for 20 seconds. And then relax. And we can next, in this lengthening phase, we're going to be performing a hamstring stretch from a 90-90 position. So I'm going to position her leg here and take the leg into full knee extension, which she's able to do. So then from that point, I could add a little bit of hip flexion. And now, Mom, what I want you to do is try to take your heel down to your butt, okay? Ready? 3, 2, 1. Push, heel to your butt, bend your knee. Good. I'm stabilizing. She's pushing down, 3, 2, 1. Relax. And I'm going to straighten out that leg. Add some more hip flexion because she does have good range of motion. And hold this stretch for 20 seconds. And then if I wanted, I could repeat on this leg again for another rep. And then switch to the other side. For the lengthening phase of this program is going to be a piriformis stretch, neuromuscular piriformis stretch. So what I'm going to do is have her supine, place her foot on her opposite thigh, and then I'm going to stabilize here at the ASIS, and then push her knee across the body like I'm trying to get it to her opposite shoulder. How do you feel stretching the backside of your butt, Mom?
Yes.
Now what I want you to do is push your knee against my hand. Ready? Open it up. Good. Now hold it. Good. Hold. Push. Push. 3, 2, 1. Relax. And now I'm going to push back across. Get a good stretch there?
Yes.
How's that feel? Pretty good?
Hard. Yeah.
Okay, and we're going to hold this for about 20 seconds. I think this is one that she might want to repeat. And then we could do it to the opposite side as well.